Public health analysis of the relationships between bone health, obesity, and diabetes using the viscoplastic energy model of the GH method. Math Physical Medicine number 1201, VMT Sharp 591, January 9, 2025. By Gerald C. EclaireMD Foundation. Category Public Health. Abstract. Key messages. Senior patients with obesity or diabetes should be extremely cautious to avoid falls and bone fractures. Obesity and diabetes each pose unique challenges to bone health and bone fractures by impacting bone quality, increasing inflammation, and elevating fall risk. Older adults with diabetes face an estimated from 1.3 to 2.0 times greater risk of fall-related events compared to their non-diabetic peers. This risk is even higher when focusing on serious fall complications, such as hip fractures. A more detailed pathophysiological explanation is provided in the biomedical information section of the main body of this article. Prevention strategies should focus on lifestyle changes, including nutrition and exercise, to manage obesity and maintain optimal glycemic control for diabetes, as well as addressing medication effects, to reduce fracture risk in individuals with obesity and diabetes. In summary, some of interesting statistical findings are listed below. Bone fractures data and trend. Bone fractures increased from 7.8 million in 2010 to 8.8 million in 2024, with a mild growth rate, averaging 8.31 million annually. Obesity prevalence rose from 35.7% in 2010 to 46.0% in 2024, with a mild increase rate, averaging 40.83%. Diabetes prevalence grew from 8.3% in 2010 to 12.0% in 2024, with a mild increase rate, averaging 10.14%. Correlations of bone fracture rate versus obesity and diabetes. Bone versus obesity equals 97%. Bone versus diabetes equals 97%. Aspirational health targets and VMT normalization factors. From a broad public health standpoint and purely as rough aspirational targets, many experts would like to see obesity prevalence under 15%, diabetes prevalence under 5%. These figures approximate where US rates stood decades ago, before the modern surge in both conditions. They are not official targets set by any one agency, but serve as a rough benchmark for what might be considered a far healthier level at the population scale. Therefore, the author wishes to normalize current prevalence data against these aspirational targets. The normalization factors for obesity and diabetes prevalence would be chosen as 15% and 5%, respectively. Disclaimer: these targets are illustrative and should not replace formal guidelines or goals set by public health authorities. VMT energy analysis results. Obesity energy contribution 57%. Diabetes energy contribution 43%. In this VMT analysis, higher viscoplastic energy indicates a greater likelihood, or stronger influence on bone fractures and their complications, from one of the two factors, obesity and/or diabetes. In terms of viscoplastic energy, obesity contributes 14% more than diabetes to the bone fracture situation in the US. VMT energy growth stages. During the first stage 2010 to 2016, the energy increased from 0% to 50%. During the second stage 2017 to 2021, the energy rose from 56% to 68%. During the third stage 2022 to 2024, the energy grew from 85% to 100%.